Kia ora whawhānau and welcome back to another Women's Health Action Trust Digi Update. I'm Caitlin, our Digital Media Health Promotion Coordinator. Now we have had some new information come out from the government, information for people who are planning to breastfeed or people who are breastfeeding right now during Covid-19. Now it's a little bit of writing, and we understand that it's a busy time for a lot of people and not everyone might have the chance to sit down and read it in full. So what we're going to be doing today is I'm just going to read it out to you, and feel free to listen podcast style if that's a nice accessible way for you to get this information. Otherwise, we kind of just want to shout that out and point you in the direction of this information. We know that breastfeeding was a concern that a few of you had based on data from our maternal survey that we did in regards to COVID-19. So we will link the website where you can find this information in the description box as well. So for now I'll read it out, so feel free to kind of move around the house and listen and take in this information. So breastfeeding is important to human health at all times, but especially in times of emergency. Breastfeeding provides immunological protections to the breastfed child. Most often, babies who are breastfed remain healthy even when their parents or other family members are unwell with an infectious illness. Those women who become infected with COVID-19 shortly before giving birth and then begin breastfeeding, and those who become infected when already breastfeeding, will produce specific antibodies and other critical immune factors in their milk to protect the breastfeeding infant and enhance the infant's immune responses. If you become unwell and you are breastfeeding your baby, it is important to not interrupt direct breastfeeding. Your baby will already have been exposed to the virus and will benefit from continued direct breastfeeding at the breast. There is no evidence of transmission of the virus in breast milk. It is okay for you to breastfeed if you have been confirmed or if you have probable COVID-19, as it is beneficial for your baby to continue breastfeeding. To reduce the spread while breastfeeding, hand washing before you feed is essential. You should also wear a surgical mask during breastfeeds and avoid kissing and touching your baby's face. If you are well enough, you should continue to breastfeed directly while using the necessary precautions. This includes washing your hands before and after contact with your baby, including feeding, avoiding coughing or sneezing on them, and cleaning and disinfecting contaminated surfaces, as should be done in all cases where anyone with confirmed or suspected COVID-19 interacts with children. If you are too unwell to breastfeed, you should express your milk and give it to your baby via a clean spoon, cup or bottle, all while following the same infection prevention methods. Your baby will also be considered a close contact of a confirmed case, and you will probably be receiving advice from this about your public health unit. Self-isolation after potential exposure to COVID-19. If you are in self-isolation after potential exposure to COVID-19, your breastfed baby should remain with you so that you are able to continue breastfeeding. Wash your hands before touching the baby, avoid touching their face and coughing or sneezing on them. Exclusive breastfeeding offers the best protection for babies, so if your baby is less than 6 months old, aim for exclusive breastfeeding. Even if your baby is older than 6 months, remaining with you and continuing your breastfeeding relationship is beneficial to you both. There's also some information here on relactation. If you've recently stopped breastfeeding, it is possible to relactate or re-establish the production of breast milk. Many women who relactate can produce enough breast milk to breastfeed an infant exclusively. The easiest way to bring back milk supply is through the baby suckling at the breast. The more often a baby suckles at your breast, the more likely your breasts will make milk. You can talk to your midwife or your well child nurse for more information on re-establishing your breast milk supply if this is something you would like to do. More relactation and induced lactation information is available on the Australian Breastfeeding Association's website. So this is what the government's put out regarding COVID-19 and breastfeeding. So we really want to reiterate that you can still breastfeed if you have COVID-19 or if you've been in contact with someone with COVID-19, and it's actually really important to keep breastfeeding because there are a lot of immune benefits to doing so. Now remember, we will link this website in the description box, so if you want to go and check it out for yourself, and there's a few links on there as well, feel free to do so. In the meantime, stay safe and we will see you in our next update.